For more on Robert F. Kennedy Jr., let's bring in CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News. Dr. Gounder, you are the perfect person to have with us this morning to help us understand RFK Jr. as a pick. HHS, what does it oversee and how much power does the secretary have?
HHS is a massive agency. It includes Medicare, Medicaid, NIH, the CDC, FDA, and more. So it really does cover quite a lot. The HHS secretary, typically their role has been to align the strategies, priorities of the agency with that of the president, with the administration. But normally you have civil servants, scientists, career scientists who are not political appointees, who vet the science, who make recommendations to the HHS secretary. But we have heard that there are plans to get rid of many of those civil servants. Whether that actually happens will determine whether the HHS secretary, if that ends up being RFK Jr., is able to follow through on his plans, because these are the people who know how to get things done.
And these civil servants are people like Dr. Anthony Fauci when he was at the NIH, I think it was?
He was head of the NIAID, which is one of the institutes at NIH that's in charge of infectious diseases and allergies.
So one of his most controversial stances is his views on vaccines and saying that they could cause autism and other medical conditions. And we saw in the clip, he said there's no vaccine that is safe and effective. What's the reality here?
So vaccines, to be very clear, do not cause autism. The, quote, research that claimed that vaccines caused autism was rife with ethical issues, was sloppy research. The guy who did that work had his medical license withdrawn because it was so unethical and sloppy. And it matters because not only are you reducing vaccination rates with that kind of disinformation.
Because you're perpetuating this idea.
Exactly, and you're putting kids at risk. Not only the kids who are not getting vaccinated in your home, but also kids out in the community who might be immunocompromised and so on. But it's also a red herring for people whose kids have autism, who they themselves have autism. You're distracting from the kind of research and treatments that might actually help those kids.
But so, Dr. Gounder, if you just go to the HHS website and look at the mission is to support and promote the health of Americans. And we talk about it all the time, how our health is not good. Life expectancy is going down, chronic disease burden is going up. Are there things that RFK Jr., as unorthodox as he is, could do to help the situation? Well,
he has said he wants to take on ultra-processed foods, which we talked about here many times.
Sounds like a good idea.
Which sounds like a good idea. He wants to take on additives, preservatives in food. In fact, many at the FDA have wanted to do this. The question is, will Congress expand FDA authority to regulate some of these things? We also know that Republicans have tended to be anti-regulation. Susie Wiles, the new chief of staff to President-elect Trump, has been a lobbyist for the food industry. And so whether this will play out, whether RFK Jr. will have his way in the face, in the light of these opposing forces in the administration.
Seems like a tall task.
It is. It's very political.
Oh, man. All right, Dr. Gounder, thank you so much for joining us.